Chapter 27, Drugs for Cancer Therapy. Why does somebody get cancer? What's the etiology? It's relatively unknown. It could be from environmental, lifestyle, occupation, genetic, and ethnic factors. Usually age and gender differences. And then the treatment considerations depends on what stage the cancer is in, and then the general health of the client. In normal tissue, cells are orderly with well-regulated growth. There's a careful balance between controlled cell division and natural cell death. With cancer, there is abnormal, invasive cell growth with no useful purpose. Abnormal cell growth, such as a mole or a skin tag, is very common. They are benign tumors and are types of abnormal cell growth that are usually harmless unless they compress vital tissues. In cancer, there's a continuous cell division occurring. Once normal cells lose control of their process for normal cell growth function, it turns into cancer cell division. Metastasis is the spread of cancer cells into other body areas of cell growth. They invade and they destroy important organs. Carcinogens are substances or events that damage normal cells' DNA and cause cancer. What are some examples of carcinogens? Chemicals, physical agents, and viruses. Benign tumors grow by enlargement, and they do not invade other tissue organs. Another term associated with cancer is neoplasia. It is a new or continued cell growth that is not needed for normal development or replacement of dead and damaged tissues. What are some examples of benign tumors? Moles, polyps, skin tags, endometriosis are just a few examples. Chemotherapy is treatment of cancer with chemical agents infused into the body systemically. Chemotherapy damages cell DNA and interferes with the cell division of the cancerous cells. Chemotherapy does destroy normal cells and destroys cancer cells. Normal cells most affected by chemotherapy are those that rapidly divide, like skin, hair, intestinal tissue, and blood-forming cells. Tumors are most sensitive to chemotherapy and those that have rapid growth. Patients with metastatic cancer will die unless treatment eliminates the metastatic cancer cells along with the original cancer cells. Chemotherapy is useful because it's cytotoxic and its effects are systemic, meaning all over the body, which can kill metastatic cancer cells that may have escaped local treatment. Chemotherapy used along with surgery or radiation is called adjunctive surgery or adjunctive therapy. All chemotherapy drugs have affect normal cells as well as cancer cells. Chemotherapy drug categories consist of specific actions and different, but the outcomes are the same. The drug categories are anti-metabolites. They are similar to normal metabolites needed for vital cell processes. Because these drugs do not function as proper metabolites, their presence impairs cell division. Anti-tumor antibiotics damage the cell's DNA and interrupt DNA or RNA synthesis. Antimitotics agents interfere with the formation of tubules so cells cannot separate during cell division. As a result, the cancer cell either does not divide at all or divides only once. Alkaline agents cross-link DNA, making the two DNA strands bind tightly together, inhibiting cell division. Topoisomerase inhibitors disrupt an enzyme, the topoisomerase enzyme, needed for DNA synthesis and cell division. Miscellaneous drugs are those with mechanisms of action that are either unknown or do not fit within other drug categories. Oftentimes, there's a combination of chemotherapy, where 2 or more anti-cancer drugs are given on a specific timed schedule. That is then called a protocol. There is a more successful outcome than with use of a single drug therapy. However, the side effects increase greatly. Issues with chemotherapy. Schedules maximize the number of cancer cells killed and minimize damage to normal cells. There are many unpleasant side effects. Continuous support strategies encourage completion of treatment when patients feel very tired and sick. Special training is required for administration. There are approved chemotherapy courses for registered nurses. All nurses care for patients on chemotherapy. The major complication is extravasation, where there is pain, infection, and tissue loss. Surgical intervention may be required. Personal protective equipment is required when handling chemotherapy drugs and waste secretions of patients. Schedules may vary somewhat to accommodate the patient's response to therapy. Most often, chemotherapy is scheduled every 3 to 4 weeks for a specific number of times, usually 4 to 12 times. Protocols of giving higher doses of chemotherapy more often, called dose-dense chemotherapy, may be used for aggressive cancer treatment, especially for breast cancer. Dose-dense chemotherapy also results in more intense side effects than traditional schedules. What is excavation? It's a condition in which a drug leaks into tissues surrounding the infusion site, causing tissue damage. Administering chemotherapy drugs. Always check the white blood cell count for adequacy. Make sure the IV is patent. Typically, a portacath is in place because of long-term chemotherapy use. Check the patient's weight to calculate the dose, obtain vital signs and mental status, and administer medications prior to chemotherapy. During chemotherapy, the patient is monitored the first 15 minutes for vital signs. Assessment is done for any allergic reaction, and the IV site is checked for any excavation. Afterwards, findings are compared with the pre-chemotherapy assessment. Why are white blood cells checked? Many chemotherapy drugs suppress bone marrow activity, especially white blood cell count, increasing the patient's risk for infection, and this will be important later on. What types of pre-medication may be ordered and why? Antiemetics are used to prevent nausea and vomiting. An example of an antiemetic is Zofran. Anti-inflammatories, anti-anxiety drugs, and pain medications may be administered prior to chemotherapy. What signs and symptoms may indicate excavation? Swelling or redness at the site, lack of blood return, pain or burning at the infusion site. Patient teaching for chemotherapy. Temporary or permanent physical changes are possible. There's life-threatening bone marrow suppression that will lead to immunosuppression, also known as anemia, which will show a decrease in red blood cell count, also a decrease in the erythrocytes, neutropenia because of a decrease in white blood cell counts, and thrombocytopenia because of a decrease in platelets. So good hand washing is mandatory. So again, what is anemia? It's a decrease in erythrocytes and the red blood, which are the red blood cells. What is neutropenia? Severe white blood cell suppression with increased risk for life-threatening infections. What is thrombocytopenia? Reduced number of platelets. Thrombocytopenia can increase the risk for excessive bleeding. A side effect of chemotherapy is known as alopecia, that is hair loss. It may occur all over the body, and it may be mild or severe. Most of the time, hair loss is temporary. Regrowth usually begins about 1 month after chemotherapy ends. However, the new hair may be different from the original hair color, texture, and thickness. There can be also loss of cognitive function, and that is referred to as a chemo brain. Here are adjunctive agents, or some premedications: antiemetics, Zofran, rescue agents, Mesna and leucovirin, and blood-forming agents. These are important. Erythropoietin, or Procrit, for low red blood cells, filgrastim, or neutropin, Neupogen, for low white blood cell counts, and Neulasta, also for low white blood cell counts, and Numega, for low platelets. These blood-forming agents are given to the patient to help produce the blood cells that they are deficient in. Always remember to check the labs for red blood cells, white blood cells, and platelet counts. Lifespan considerations for chemotherapy: pediatric. The side effect is the same for adults. They may not always understand the purpose and the length of the treatments. Recover bone marrow functions occur faster than adults. For pregnancy and breastfeeding, most induced birth defects, so chemotherapy agents are not recommended and avoid during breastfeeding. For older adults, neutropenia can occur as a side effect, also nausea, vomiting, peripheral neuropathy. They may become dehydrated. If CINV happens, that's chemotherapy-induced nausea and vomiting. So there is usually prescribed antiemetics, and if the nausea and vomiting is not resolved within 12 hours, then the prescriber has to be notified. Hormone growth slows tumors. Hormone inhibitors stop production of hormones in hormone-producing glands. The side effects are androgens and estrogens. This is action of hormones and anti-inflammatory hormones on hormone-sensitive cancer cells. Biological response modifiers: interleukins, interferons, thalidomide, colony-stimulating factors, and then there's the side effects. When tumor blood vessels are reduced, the tumor is poorly nourished and cancer cells die. When bone marrow suppression is shortened or less severe, patients are less at risk for life-threatening infections, anemia, and bleeding. These drugs can be given to help immunosuppression therapy. Targeted therapy. It's a combination of gene therapy and immunotherapy. Some of these drugs target and block growth factor receptors. When a cancer cell growth depends on having the growth factor bind to their specific receptors, blocking the receptor slows or eliminates the cancer cell's growth. Other agents for targeting therapy may be antibodies directed against a cellular substance needed by the cancer cell for growth, or a substance in the cell's signaling pathway that is important in turning on certain genes for cell growth. Targeted therapy can block these pathways so that the signal for turning on cell division genes does not get through the cell's nucleus. There are side effects with these medications that occurs in tissues that normally express these receptors, such as skin, mucous membranes, and lining of the GI tract.